Hi, I'm Nancy McCammon Hanson. I'm a Roost volunteer based in Fort Wayne, Indiana. And today we are going to be talking with Monica Dubois, who is part of AARP's Community, State, and National Affairs programs. She's going to be talking about health and caregiving, which is something that all of us, regardless of our age, probably ought to be paying a little more attention to. This is a new program for AARP, and we're going to be talking about the program concept, new lead volunteers, and basically an overall view of what this program is. So, Monica, if you would be willing to let us know a little bit about what you do in your job.
Great. Well, thank you, Nancy, and a big thank you to the Roost for inviting me on. I've been looking forward to our conversation today, so thank you. Like Nancy said, my name is Monica Dubois. I work with Bob Stevens' team at AARP National Office. My focus in my role is to really enhance volunteer engagement strategies. I'm just so passionate. I've spent my whole entire career working with volunteers, and I was excited to bring that background and skill to the team at AARP National Office. Like you mentioned, my focus is really health and caregiving programs. I've been a nonprofit professional for the last 20 years. I have extensive experience working with volunteers and developing programs, very similar to what I'm doing in my role now. And I just really bring a huge passion for helping people. That's really been my focus throughout my career. I enjoy driving meaningful initiatives like I'm doing with ARP to support families and caregivers. So that's a little bit about myself.
Well, thank you. I appreciate that. Um, Thinking about caregiving as a starting point, and we're going to be going through several layers of what caregiving is about. Um, and this is something that my husband and I have been talking about. How many seniors, do you have any idea what portion of seniors today will need a caregiver down the road? And do people really think about the fact that as you get older, you may not be able to do everything you did when you were in your 20s?
hmm Yeah, so looking at the numbers, about two-thirds of those over 65 are going to need long-term care at some point. So that's what we know in terms of number. Um, we know in all likelihood we'll all need help as we age in some capacity. So those are just some truths. We like to refer to a quote that we heard from former First Lady Rosalind Carter. It's a very famous quote, and she captures it quite well. She says, there are only four kinds of people in the world: those that have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. So we're all going to fall into one of those buckets over time. Carter believed that caregiving is a universal experience, which it is. It affects everyone at some point in their life. She also recognized that caregivers are the backbone of this country. So we really, we're making things work for our families, but caregivers are in crisis. So that's why AARP has created some programs around caregiving to help, knowing that everybody is going to be affected by it at some point in their lives. In terms of numbers too, there are about 48 million people providing unpaid care to another adult in our country today. That's a huge number. It's a roughly like 1 in 5. And what we know is true too is as we age, we may see more caregivers caring for more than one person. So it's not just one-on-one care. You could be caring for multiple family members or multiple friends. So it's important to note also that anyone at any age could be a caregiver. That's not specific to age. So we do know that about half are over 50, 20% are over 65, but there's another number to look at, and that number is 25% of caregivers are under 35. So it's not age specific. Everybody can be a caregiver at any age. So it's never, like you mentioned with your husband, it's never too early to start thinking about your own care. You never know when you or a loved one will need care. And so it might come on suddenly due to some kind of emergency medical situation, or it can emerge slowly over time. It's not universal in the way that it comes into your life. It's challenging to get people to plan ahead, though, is what we've found. But it is important to make sure that you have your financial and legal documents ready, ensuring that you know who is going to help care for you, making sure they know what you want. That's another important part, Nancy. And I think those are some things to consider as you age. Um,
Our son was here visiting from New York City uh, in late January, and it was about a week before his 40th birthday. And I kept thinking, if something happens to him and he needs a caregiver, we really don't want to move to New York City. If something happened to us, he really wouldn't want to move to Fort Wayne, Indiana, having lived in Boston and New York City.
mhm,
I'm finding that many of my friends are taking care of elderly parents now. And it's a rather eye-opening experience for those who are like my age, early 70s, to like look around a parent's house and say, gosh, maybe they really ought to change that. I know my mother at one point said to me, I couldn't walk around my house with a walker, and she was right because it was 4 stories. And
mhm,
get to a bathroom, you either had to go upstairs or downstairs, and if you used a walker, plus the amount of furniture in the house. So it's you're right, it's really something to be thinking about all your life, which is kind of
mhm,
scary, but it's that's the way it is. So
mhm.
um the access to affordable, and I really want to emphasize that word affordable, because long-term care is not cheap. Um, it's a major priority of AARP, correct?
Correct.
And give us a little background about long-term care as far as like nursing homes and that kind of thing. Um, why is it so expensive? Do you know?
Yeah, so we hear this a lot from our members at AARP. The long-term care is critical. Um, Either as they'll know they'll need it at some point in their life, or they'll have to interact with a family member that may need it. And our focus is really family caregivers. This is a term that we use, but it really applies to anyone providing mostly unpaid care for another adult, family, like parents or a spouse, grandparent, friends, neighbors. Some people don't even identify with that term caregiver, because, it's just what you do for a loved one. Um, and we know that caregivers provide the majority of care in our country. If you had to put a dollar amount on it, it would be about $600 billion annually. So that's a huge number, right? So
Oh,
talking about costs that are associated with caregiving, that's a huge number. Um, so the answer is complex. We know that most people want to get care at home. They want to stay in their homes where they're comfortable. You talked about this just a little bit, like you would feel most comfortable in your home and maybe adapting your home, making modifications to your home, services, and then preparing family caregivers so that they can do that. We've also seen that there's a shift in how care is provided. Much of what once required a trained clinician to do, we can now do at home with family caregivers. So there is a movement to make sure that people are staying at home, and we're providing them resources and caregivers to be able to do that. Some do need support from a senior living or a skilled nursing home. And if you live in a more urban setting, those are likely available. But what we're finding is that increasingly in rural communities, those aren't always accessible. And then because of cost, they aren't always accessible to everyone. Um, so ARP routinely asks, like, those over 40 or 50 about what their preferences are. And for years, this number has been roughly the same. So 9 out of 10 adults want to remain in their homes and in their own communities. Like you said, in your home state of Indiana, they want to stay where they're comfortable, where they know people, where they know their communities. So they want to stay there. And I think we can all relate to that. We want to be at home with our friends and family, but it's not always possible. But this is what we want. So while most caregivers take on the role willingly, it comes at a cost in terms of money, time, personal health, because the lack of a system that includes them and lack of supports. That's what we're fighting to change at AARP. We're doing that through our advocacy, such as fighting for the family caregiving tax credit, or our consumer resources, which are used by 62% of all caregivers are coming to AARP for resources to be able to care for their loved ones at home. And then what AARP is doing is we are delivering on community programs. So we are showing up in your communities to help people to care for their loved ones in their home where they're most comfortable. And that kind of brings me to this new program that we're starting. So I'd love to tell you a little bit more about that.
And that was going to be my next question. Can you tell
Oh,
us about,
we're on the same page, Nancy.
right, can you please tell us about the Care Connectors?
Sure. So our team was looking at what we just talked about. How can we show up in communities to help caregivers support their loved ones where they're most comfortable? So that we're starting a new program. It's the formal title is the State Liaison for Caregiving Initiatives. So, but what it really is are caregiving lead volunteers in their state, a care connector, a volunteer that can help us deliver on these essential community programs. So volunteers will help us link the local efforts with the national priorities and strategies. And we want to show up in local communities and help caregivers. We're going to do that by developing, coordinating, and implementing caregiving programs and initiatives alongside state offices. So these volunteers will make sure that caregiving resources are reaching the people that need it most, that they're communicated well, adapted for the needs of their local communities, and executed so that they can best serve their people. The volunteer will build awareness around caregiving. So just like we talked about today, I'm not sure a lot of people know what caregiving is, how to identify as a caregiving, what those startling statistics are. So they're going to help us share that messaging in their communities, foster partnerships so we know that we're stronger together. So partner with other organizations and people in their communities to build a strong force to support caregivers, and ensure alignment with our mission to support family caregivers. So we're looking for volunteers to be in their local communities to really make an impact for these caregivers.
So, if you want to be a caregiver volunteer, do you have to have a medical background or expertise in finances for senior citizens or knowledge about home interiors and their design for getting around if you're in a wheelchair or to use a walker? What kind of background are you looking for in a volunteer?
So you don't have to have any expertise. That's the good news. No expertise needed. This role is really perfect for people who are just passionate about supporting family caregivers. If you want to help, then we want you. We want just the passion for it. If you have a passion for improving the quality of life for older adults and their families, for supporting family caregivers, we would love to have you as part of this pilot. We're currently recruiting in states and volunteers to participate. We're just launching, so our first meeting will be in March. So now is a great time to join as we kind of kick off in the beginning of this year. And then the pilot will run through August with hopefully full implementation in 2026 across the country. So that's a little bit about our timeline and where we're going. And really, we're just looking for volunteers that want to help family caregivers.
Okay, so basically anybody could volunteer, right?
Hmm.
Okay.
Yes.
I find this really interesting. My husband and I used to live in Broken Bow, Nebraska, which is a town of 3,700 or so people on the edge of the Nebraska Sandhills. And
Hmm.
a former resident gave the city enough money to start a hospital there.
Wow.
And they're like almost smack dab in the middle of the state. But he said, Mr. Mellon said that a hospital in a rural community is not going to be a moneymaker necessarily. So they added on apartments, assisted living, and a nursing home. And
Hmm.
it was very interesting. And there are a number of places here in Fort Wayne that I hate to use the word cater to seniors, but are senior living complexes. And I've never seen that in a community where we have lived, that the amount of complexes where people live who are senior citizens. But it really does make sense. Um, and that you've got people around you, but you can still have your privacy. And so
Mm-hmm.
many of us don't have children who live in the same community where we live. Uh,
Mm-hmm.
I have a new friend
And
who is a widow and is selling her home, and she's been donating books to a homeless shelter I used to work for. And she has several children. Not one of them lives here. And so
mm-hmm.
she's selling her beautiful house and buying something smaller because she needs to be closer to town.
Mm-hmm.
She lives on the edge of the city, and she doesn't need as much space as she has. Her house would make a beautiful hotel, but it I guess it has really dawned on me that, say, when you're 45, 50 years old, you think, oh yeah, I've got lots of time, but you're getting older, you know, and you really need to be
Mm-hmm.
thinking about your future, because most of us now will probably live into our 90s.
Mm-hmm.
Um, do you know what it used to be that what men lived to be, the average was 78 and women was like 82, something like that. But
Yeah, that sounds right. And we are getting older, like as a population. So we do need to prepare for those years. And caregiving can be done long distance too. So we have supports for long distance caregivers. So even if you're out of state, in what ways are you showing up for your loved one? Are you calling to check on them? Are you talking to doctors long distance and checking on their care? And so caregiving can be done across the country with your loved ones. But I really like the idea of building community with friends. I think caregiving doesn't always have to be a family member. It could be a friend too, that it may help you drive to doctor's appointments or organize things at home. So family caregivers aren't always family. They can be good friends too. So that's something to just consider.
do you do any work, or have you planned to do any work to help people who are caregivers, who are trying to care for a person who is fighting having a caregiver? I know
Yes, so
my
that is,
mother had a
yes.
hard time with that for a while until she finally realized that it
Uh-huh.
was helpful. Yeah.
Yes, we have some resources available to have difficult conversations like that, where it's our prepare to care. Within that, we have some planning documents and planning strategies, and having those more difficult conversations with your loved ones. I think sometimes it gets a little difficult too around financial decisions that have to be made when you're losing access to driving, or it might not be safe to drive. I know we have our driver safety education. So AARP provides so many resources to people when they're having those more difficult interactions with loved ones.
That's good to know. Good to know.
Hmm.
Okay, as we come to a close on this broadcast, is there anything else you'd like to add or let people know?
Yeah, so I just want to say that I love volunteers. It's been my career's work to work with volunteers, and I just appreciate all the time and work and investment they contribute to helping people around our country, and specifically AARP. I've met some just tremendous volunteers in my time. We talked about, as we started the podcast, being in Nashville at the confab, and it's been an honor and a privilege to work with volunteers throughout my career. So thank you for all the meaningful impact that you've made. But I'm really excited about this initiative around caregiving, to create a supportive community where caregivers can thrive. And if you're interested in joining, you can reach out to me. Again, my name is Monica Dubois, Dubois. So it's NDUBOIS at AARP.org if you'd like more information or would like to get involved about this initiative and the work we're doing around caregiving.
Okay, thank you so much.
Thank you, Nancy.
We encourage you to, all of you who are listening and or watching, to tune in to The Roost. We have done a number of videos and podcasts over the last several years for volunteers, AARP volunteers, of which I am one here in Fort Wayne, and lots of good information. AARP has done some amazing work in our country and continues to do that, and really deserves our support. So invite someone to listen in, and we thank you for listening and watching this particular program. And thanks, Monica. Good to see you.
Thank you.